So in our last video, we talked about some introductory bits about anemia, and we talked what anemia actually is. So what is anemia? Anemia is the reduced RBC mass. That means we have less RBCs in the blood than before. And we talked about why is it that RBCs are important in our body. So to recap a little bit, RBCs actually carry all the oxygen from the lungs and take the oxygen to the tissues, and eventually we get ATP. So RBCs are a must for our body to function. And lastly, we talked about why is it that we get the classic symptoms of anemia, and we tried to explain all of the symptoms separately. In this video, I will talk about the explanation of why we don't use RBC mass, that is, we don't measure the RBC mass to measure anemia, because let's think about it practically. How can we even calculate the mass of all the RBCs? That we can't just take a scale and, let's say, put a weight here, like a 5 kilogram weight, and measure all the RBCs, right? We can't do that. That's not possible. So what we will do instead is we have some alternative measurements to measure the RBC mass, the measurements that will actually reflect the RBC mass. So first up, we have the RBC count. So that is how many RBCs we have in every microliter or cubic millimeter of blood. The classic RBC count that we get from CBCs or FBCs if you are a British. So a complete blood count gives us the RBC count. So what's the normal RBC count? So for the purpose of this video, let's just keep it simple and say it's 5 millions per microliter. So that's the normal RBC count. So for any reason, if we do a CBC and get a count less than 5 millions, well, it varies from, let's say, if the person is a male or a female, or if the person is, let's say, an infant, it varies. But let's just say the average value is 5 million per microliter. So if it comes less than 5 millions, we can say that the RBC count is low. And if the RBC count is low, then obviously the RBC mass is also low, right? So RBC count is our first alternative measurement. So RBC count is one of the alternative measurements that reflects the RBC mass. So that means if RBC count is low, RBC mass is low, that means we have anemia. So what's the next one? Next one is very commonly the hemoglobin concentration. So the concentration of hemoglobin in the blood, and we know let's say the normal value here is 14 grams per deciliter of blood, or 1 deciliter is actually 100 milliliter. So 14 grams of hemoglobin in a deciliter of blood. That's our normal value. So if for any reason it comes lower than that, if the value is lower than 14, then we can say that the hemoglobin concentration is low. So where are these hemoglobins situated in our body? Obviously inside of the RBCs. So the decreased hemoglobin concentration actually means we have less hemoglobin. That means we can say less functional RBCs, right? Because RBCs were carrying oxygens. RBCs were carrying oxygen molecules throughout the body. So now we don't even have enough hemoglobin. So even if we have a lot of RBCs, it doesn't really matter, because we don't have hemoglobins, which is actually the molecule that will carry the oxygen. So a reduced hemoglobin concentration will tell us that the patient has anemia. So that's the second alternative. And now let's move on to the third one. That is a very reliable test, you could say, but not very specific. That is the count of PCV, or hematocrit. So what does PCV stand for? It stands for packed cell volume. So the volume of RBCs is actually known as PCV, and hematocrit is the alternative for that word. So we can also call it hematocrit. So what is actually PCV or hematocrit? We will have to discuss it a little bit extensively to understand why PCV is important and what are some limitations we can face when we are trying to measure anemia based on PCV. So that we will do in the next section. So let's talk about PCV for a little bit. So we need to understand this because it's the one of the alternatives for measuring RBC mass. And what's normal? Let's first look at that. So PCV is actually, or hematocrit is actually the percentage of RBCs that are present in the whole blood. So that is normally 45%. So that means if we take a blood, so I have tried to give a demonstration of what is post-centrifugation column of blood looks like. So this is the RBC column, and this is our buffy coat. So this is the buffy coat. That means these contain the WBCs and platelets, and on top of all of these we have the plasma. So this is the plasma layer, and plasma is the most abundant of all three of these. So plasma contains 55% of all of blood. So that is plasma, and 45% is RBCs, and that's our normal. So if we have a reduced number of RBCs, what will happen to our hematocrit? Well, we can very easily think or imagine that the RBCs will be less. That means our hematocrit will also come down. That is, it will be less than 45%. So less than 45% means we have less than normal number of hematocrit. That means we have less than normal number of RBCs. Most commonly, we can say that reduced hematocrit reflects anemia. That is, reduced hematocrit means reduced RBCs in the blood of the patient. In some cases, we can't say that safely, because let's imagine that a patient has more than usual amount of plasma. So plasma was this much, now the plasma is this much. So this patient has more plasma than usual. So now, even if the patient has a normal level of RBCs, a normal number of RBCs, we can say that the percentage of RBCs is obviously less than 45%, because this much RBCs in compared to this much plasma now will never be 45%, because remember, the plasma was this much in the normal case. So if we, for some reason, have plasma expansion, so this is a case of plasma expansion with normal number of RBCs, but if we measure the hematocrit, we will get less than 45, and we might be fooled to think the patient is anemic. So what are some causes of plasma expansion? A very common cause can be pregnancy. So a pregnant woman has a enhanced amount of plasma volume, because remember, a pregnant woman has to supply the fetus as well. So blood volume has to be more. So pregnancy is one of the causes. So other than pregnancy, if we think that a patient has been infused with a lot of saline water, then also the plasma can expand, and in that case also we will get a false reduced hematocrit value, but the patient is actually not anemic, because actually the enhanced amount of plasma is making us think that the patient has less RBCs, but actually the hematocrit is normal. And the next problem we might face is if a patient has less amount of plasma than usual. Let's say this much plasma is present in this patient. So we have the same amount of RBCs actually, but with respect to our reduced amount of plasma, actually we will have a false result of more than normal of hematocrit, that is more than 45% of hematocrit. But that does not mean that the patient has more RBCs than normal. Actually, we're getting a false representation of how much RBCs that the patient has. So this is a case of plasma contraction. So that means plasma is not in the normal range. Plasma has been reduced. Why will it happen? Well, very easily we can think that if there is hemorrhage, or there is diarrhea, that is severe diarrhea, or if there is vomiting. So any of these reasons where there is plasma loss, we can say there is plasma contraction, and with respect to a contracted amount of plasma, we get a false value of raised hematocrit, which is not significant clinically at all. So actually, these two are the limitations that we will have to think about when we are measuring our RBC mass using the value of PCV that is normally 45%. So the PCV value, when it's less than 45%, we can say there is anemia. Obviously, if there is no such conditions as plasma expansion or plasma contraction. So I've talked a lot about the alternative methods of measuring the anemia, that is reduced RBC mass. So to summarize, we have firstly the RBC count. So if we have a less than normal count of RBC that is less than 5 millions per microliter, or we can say it's a millimeter cube. So if we have this value, we can say that the patient has anemia. Or if the hemoglobin concentration is less than normal, we can also say that the patient is anemic. And lastly, in all types of anemia, we will have a reduced hematocrit value that is less than 45%, or whatever the normal value of the lab is. So if these three are reduced for some reason, we can say there is some sort of anemia. So what is the type of anemia that we will talk about in the next video? RBC indices will actually guide us through the classification of anemia. So that will be the topic of next few videos. So until then, keep learning and stay sharp.